To begin the New Zealand perspective, let's review the definition. Infant mental health is synonymous with healthy social and emotional development. The definition, developed by the 0 to 3 Task Force in 2002 and widely in use throughout the world, has two parts. It is the developing capacity of the child from birth to fourth birthday to experience, regulate and express emotions, to form close and secure interpersonal relationships, and to explore the environment and learn, all in the context of family, community and cultural expectations of young children. It is additionally the discipline of practice and research that focuses on the promotion of healthy social and emotional development, the prevention of mental health problems, and the treatment of the mental health problems of very young children in the context of their family. It is a multidisciplinary field, and in New Zealand our infant mental health networks have representation from early childhood care and education, mental health, child protection and family law. Deborah Weatherston has referenced the pioneering contribution of Selma Freyberg, working at the Child Development Project in Michigan, developing the infant mental health approach to practice, which she documented in 1980 in her book Clinical Studies in Infant Mental Health. New Zealand's first infant mental health service, the Developmental Centre in Dunedin, was based on Selma Freyberg's service, attending to the infant, his parents with a strong commitment to including fathers, the developing relationships between them, and the ghosts in the family's nursery. The service ceased to be in the early 1990s, but its influence on practitioners and infant mental health practice in New Zealand continues. We're working with families at an exciting time, with expanding knowledge in the neurosciences helping us, amongst other things, understand how an infant's genetic potential can be supported or not by the quality of nurturing in the environment. Nearly all of the elements of early human development are affected by the early parenting and care environments, and experiences during the antenatal period, infancy and early childhood have the capacity to promote or impede development. There's accumulating prospective evidence that early adverse social, emotional and relational experiences are linked to poorer physical, cognitive and mental health outcomes in childhood, adolescence and adulthood. Infants and toddlers experience problems with their social and emotional development relatively commonly. By 18 months, 16 to 18% of infants meet criteria for one or more disorder. In environments with additional adversity, families living in poverty, infants exposed to family violence, infants whose parents may have alcohol and addiction problems or mental health difficulties themselves, who were abused or neglected as children, are likely to have increased rates of disorder. It is the discipline of infant mental health that offers the opportunity to intervene, to support the infant who may be on a problematic developmental pathway, to support their whānau, to support practitioners working with families with training and reflective supervision, and to promote research. In New Zealand, the social and emotional well-being of infants and young children is certainly being considered in policy across health, welfare and education. Some significant initiatives support implementation from policy into practice. From a prevention and promotion perspective, we have universal health services for all New Zealand whānau for children from birth to 5 years, delivered via the World Child Tamariki Ora program. The recent revision of the Handbook for Practitioners reflects the program's intention to promote social and emotional well-being, alongside physical and cognitive development, to support family health, and to be a gateway for referral to targeted and specialist services. It has, for example, information on perinatal and infant mental health. It supports the regular review of maternal mental health, including screening for maternal depression at 6 weeks and 3 to 4 months postpartum. Background information, resources, developmental guidance and approaches with evidence of positive outcomes are provided, with referral pathways for more intensive assessment, support and treatment. In 2008, County's Manukau District Health Board embarked on a project with Auckland University of Technology to develop a series of films for parents and practitioners about the infant's capacity to communicate socially and emotionally, and their essential and primary need to have positive, predictable and nurturing relationships. The Look at You, Araha Atu Araha Mai DVDs are based on Lynn Murray's book Your Social Baby and the Australian film series Getting to Know You. It's a resource for all families in New Zealand. The film covers the first 3 to 4 months of an infant's life, providing information about the capacities of babies and supporting parents to observe and think about the meaning of their baby's behaviour. The film supports parents amongst a number of things to recognise when their baby is ready for interaction, that babies need help managing stimulation or regulating themselves, and parents can observe the early signals the baby gives that they need support with this. So the signals of distress and tiredness are demonstrated with ideas for comforting and settling their baby. Healthy Beginnings, Developing Perinatal and Infant Mental Health Services in New Zealand, is the Ministry of Health's guidance on ways to address the mental health, including alcohol and other drug needs of mothers and infants and their families. Designed to encourage and disseminate good practice, to assist over time in achieving consistency in the quality of services, and to provide guidance on cost-effective models of care. This is helpful as infant mental health services in New Zealand have largely developed in response to the clinical skills and advocacy of a small number of clinicians and with limited coordination. The development of specific assessment and intervention services for infants within child and adolescent mental health services or perinatal mental health services is slowly happening. Infant mental health is now being seen as an essential component of assessment and intervention planning for young children coming to the attention of child protection services. The Gateway program, as part of the Children's Action Plan, plans to deliver a comprehensive health, including mental health assessment. 20% of the children coming into longer-term care are under the age of 2, and they typically have been exposed to multiple complex trauma and losses. It's early days, but efforts to assess the emotional and social needs of these infants and to provide evidence-based relationship-focused interventions are to be supported and require ongoing evaluation. At this stage, New Zealand doesn't have the skilled infant mental health workforce to support the attention to social and emotional well-being that is part of such initiatives in health, education and welfare. This is a difficulty and a dilemma. We do, however, have an interested workforce, motivated to learn and with growing national and international collaborative relationships. To finish this brief New Zealand perspective, 2 further points. Reflective supervision is the 5th cornerstone of infant mental health practice, and it's a pathway for workforce development as well as good practice. Reflective supervision supports the beginning clinician and the most experienced to work effectively and to learn. In this work, attention to the relationships is fundamental, and regular collaborative reflective supervision supports practitioners with the interpersonal and intrapsychic complexity of this task. Building collegial networks with like-minded people is another. The Infant Mental Health Association Aotearoa New Zealand, IIMHL, supports practitioners and organisations working with infants and young children with advocacy, resources, conferences, regional interest groups, research and networking within and beyond New Zealand. IIMHL became the 38th affiliate organisation of the World Association of Infant Mental Health in July 2006. You may wish to consider membership of this organisation.